New and effective treatments for diseases are welcome, but the delivery of such new treatments can be very challenging, especially in an aging society. One example of such a challenge is the delivery of new sight-saving treatment to the back of the eye for people with diabetic macular edema and age-related macular degeneration, or AMD for short. AMD is the leading cause of blind registration in the Western world, and in Ireland, visual impairment attributable to AMD will increase from 80,000 to 160,000 over the next 20 years. The back of the eye is lined by a thin layer of delicate tissue known as the retina. The centre of the retina, termed the macula, is responsible for detailed vision. In macular disease, such as diabetic macular edema and neovascular or wet AMD, central vision is irretrievably lost if left untreated. Lack of treatment leaves the patient unable to read, recognise faces, watch TV or drive. As a consequence, the untreated patient becomes legally blind and loses his or her basic everyday functioning and social independence. Fortunately, however, there is an effective new treatment for these conditions. Diabetic macular edema and neovascular or wet AMD are the result of overproduction of a protein known as vascular endothelial growth factor or VEGF in and behind the central retina, which results in fluid accumulating at the macula. This is akin to a leak beneath the carpet, which will inevitably damage the delicate carpet fibres if not dealt with. However, new treatment is now available by injecting an agent into the back of the eye, and the process can be halted and in many cases reversed. This agent works to block the overproduced VEGF protein and is therefore known as anti-VEGF therapy. The Institute of Eye Surgery at Whitfield Clinic has pioneered the first patient-centred model in Ireland with an established macular disease treatment centre, designed to meet both logistical and administrative challenges in order to deliver best care and practice to patients with macular disease. The success of this treatment depends absolutely on three things. First, the condition needs to be diagnosed in time before the delicate retinal tissue is irretrievably damaged. Second, the treatment must be started at the earliest opportunity to prevent further and irreversible loss of fragile retinal cells. And third, the treatment must be delivered as frequently as is indicated and should not be discontinued prematurely. So let us start by discussing the diagnosis. A positive diagnosis of diabetic macular edema and neovascular or wet AMD and the resulting decision to treat can only be made following a comprehensive ophthalmic assessment. This assessment must include fundus fluorescein angiography and optical coherence tomography. It is important that the referral pathway is rapid, within a few days, and that such tests are undertaken at the initial consultation so that a decision to treat can be made there and then and the first injection scheduled. In the absence of immediate and ready access to these investigations, the patient will need to be recalled perhaps even to another centre, which will inevitably result in delays in performing and reporting the angiogram, as well as arriving at the vital decision as to whether or not treatment is indicated. Performing and interpreting these crucial tests at the initial consultation allows the ophthalmologist to explain the nature of the condition to the patient and his or her family, and therefore facilitates the process of informed and valid consent. Such a comprehensive consultation prevents the need for an extra visit, and given that patients with these conditions often rely heavily on family and friends for transport to and from the treatment centre because of poor vision, this is an important consideration. Ultimately, where a definitive diagnosis is made at the initial consultation, the first treatment can be scheduled while the patient and his or her family are there, thus greatly facilitating the timely initiation of this beneficial treatment. Therefore, the success of anti-VEGF therapy for diabetic macular edema and neovascular or wet AMD, a proven therapy, depends on rapid access to diagnosis and treatment of these conditions. Prompt diagnosis and treatment results in visual improvement in 40% of cases and stabilisation of vision in a further 50%. The treatment involves a series of monthly injections into the back of the eye, which must be performed under strict aseptic conditions. Given the financial constraints of healthcare providers, and given the volume of patients requiring treatment, the anti-VEGF treatment will need to be injected in an environment which is both safe and efficient. All patients will have already read and signed a detailed consent form and will have been instructed to instill antibiotic drops for 3 days preceding the injection. On the day of injection, the assigned eye is pharmacologically dilated, cleaned, and then anesthetized, and then cleaned again. Treatment takes place only after careful scrutiny of the patient's previously completed paperwork. The ophthalmologist can then move from one patient to the next, re-scrubbing and re-gowning between patients, and can therefore inject a high volume of patients in a way that is safe and efficient. This strategy has been developed to make the best use of the available infrastructure to deliver this sight-saving treatment. In conclusion, there is a new and effective treatment for diabetic macular edema and neovascular or wet AMD, but this treatment is only as successful as access to that treatment. Prevention of blindness in these conditions depends on a rapid and reliable referral pathway. This includes a comprehensive initial consultation that results in a definitive diagnosis and a decision on whether or not to treat, as well as the administrative and physical infrastructure to deliver the initial and repeat intravitreal injections in a safe, timely, and efficient manner. Timely diagnosis and effective treatment greatly reduces the risk of visual loss and greatly enhances the chance of visual gain in macular disease, thereby optimizing the patient's quality of life and preserving social independence.